walking on his own. At that point in time, you guys will be evaluated. He'll be evaluated by the anesthesiologist and you'll be discharged to go.
Okay.
As far as what to expect for the rest of the day, make sure that you're holding a hand as you walk out to the car, because he will still be a little unsteady on his feet. Make sure he's restrained like normal, in a car seat or booster and a seatbelt like he would normally be. And then for the rest of the day, take it easy. No running, riding a bike, jumping on a trampoline, any vigorous activity.
And no hard food.
Soft food for today.
Just
avoid
soft.
Sucking, spitting, drinking out of a straw, because he does have those teeth that need to come out and we want that to heal as quickly as possible. His mouth will also be numb, so you're going to want to make sure he's not biting or sucking on his lips or his cheek while that is numb as well. So just keep an eye on that. The numbness typically lasts a couple of hours, okay? With the caps, once they're placed, for the duration, you're going to want to avoid really sticky foods. So taffies, caramels, things that could pull the cap off. If for some reason one were ever to come off, you would keep that and call us. A lot of times we can just glue that back on. But we would expect those caps to be in place until the teeth are ready to get to wiggle out on their own. Okay? Any questions at all about anything that we've talked about today?
No.
Okay. We're good?
We're good.
Okay, so I'm going to go do some paperwork. Welcome to have a seat here, Mom.
All right. Okay, thank you.
Yeah, you're welcome. And I'll be back with you in a few minutes, okay?
All right.
For me? Good job. So this is like a lotion with a little bit of medicine in it to make your hand a little bit sleepy, okay? Just the top of your hand, just your skin. Yeah, I don't want to get that on our face. It's all covered up on that hand. Cover it up on this one. Perfect. That'll make your hand nice and soft under there too, okay? Recommended coming out, okay? Now if the dentist were in there and to start working and another tooth would need to come out because it was too sick or there was any other treatment needed, she would go ahead, you're seeing Dr. Kelly Rose today, she would go ahead and treat that as needed. But again, the tentative plan is the silver crowns in all areas except the lower right, and those two teeth were gonna come out, okay? Any questions on any of that? Okay. There's three sections here that I've crossed out. DNR, manufacturer's representatives, and blood transfusion don't apply to what we're doing today, so you don't need to address those. But if you want to look through this and then go ahead and sign here on the second page. These could lead to, him needing to go to the hospital, or potentially if there was a lack of oxygen for a while, some nerve damage, brain damage, okay, or mortality. Nothing that we anticipate today. We are monitoring him throughout the procedure. We have the anesthesiologist here with the dentist, several nurses comprise our team as well. But you do need to be aware that with any sedations, there is risk involved. In addition, if for some reason we were putting Ismail to sleep today and either it wasn't effective, he wasn't going to sleep well, or if he started sleeping and then he wasn't able to breathe well on his own and we're not able to do the procedure, we would stop today and talk about other options for treating him. So again, those aren't things that we anticipate, but we do want you to be aware of the risks involved. If for some reason, again, there were any complications, we would always transfer to the hospital, which is close. But again, that's a pretty atypical scenario for us here. So with the sedation, do you have any questions at all?
No.
Okay. I'll have you read through this and then time and date and relationship. Do you wanna, whoever wants to do it.